Good afternoon, and thank you for being here with us. Thank you for meeting today. Look forward to a very productive conversation. I'd like to welcome you all to this conversation where you will share justification for full remote learning in New Haven. To be clear and perhaps to address some of the misconceptions that have been shared, this process is not intended to approve or deny a plan. We know that when it was announced that flexibilities would be allowed, the governor made it very clear that ultimately districts will have to decide. In making that decision, we need districts to consider the impacts and risks for both students, both when they're learning remotely and when they're in school. We know each of you are passionate about the well-being of New Haven students and their success, and we look forward to a productive conversation. Before this, I'd like to introduce the members that are on the call from the State Department of Education and our partner agencies. In the interest of time and the need to keep this meeting to an hour, which I recognize we started a little bit late, so we're gonna end it about 10 minutes later, I'll introduce those on the review team, and I'm gonna ask Dr. Tracy to introduce those who are on New Haven's panel. So from the review team on the state side, we have myself, Commissioner of Education, Miguel Cardona, Charlene Russell Tucker, Deputy Commissioner Desi Nesmith, Legal Director Jessa Myrtle, Deputy Secretary of Office of Policy Management Costa Diamantis, Commissioner of Department of Public Health Deirdre Gifford, State Epidemiologist Dr. Matthew Carter, Senior Advisor to the Commissioner at the State Department of Education Chris Clouet, Chief of Staff for the State Department of Education Laura Stephan, and Board of Education member for the State Board of Education Erin Benham. Thank you, those of you who are joining us for your time today. Dr. Tracy?
Thank you, Commissioner Cardona, and good evening, everyone. I hope I do not forget anyone on my team, but let me say I have the President of the Board of New Haven, Mr. Sina Rivera. I have Matt Wilcox, who is also a member of the board and part of their executive committee, Dr. Joyner, Edward Joyner, the Secretary of the Board of Education, Mr. Darnell Golson, a member of the board, Mayor Elicker, a member of the board. I also have Dr. Jackson McArthur, who is also a member of the board and here tonight also. I have Maritza Bond, our local health director, Evelise Velasquez, our Assistant Superintendent for Curriculum Instruction, Ms. Keisha Haddons, Assistant Superintendent for Curriculum Instruction, Dr. Paul White, Assistant Superintendent for Instruction Leadership, I should say. I have in the background with me Ms. Tiffany Jackson, Special Ed Director. Have I left out anyone? And
Mr. Conway. Mr. Conway, yeah, board member.
Yeah, Dr. Tracy, you left me out.
I'm sorry, Laura. Attorney Mooney, who is representing the Board of Education. I think that's about it. Yes.
You got that? All right, thank you. Thank you again, all of you, for being with us. I'll start with brief opening comments, and then I'm gonna ask New Haven to present for up to 20 minutes. We'll then open the conversation for 25 minutes of question and answer that I'll facilitate. We have members on our team here that have questions for you. We will conclude with my closing remarks at the end. I asked for a review of some of the important district demographic data and a review of the spring experience. With close to 21,000 students, 15% of whom are identified as students with special needs and 17% who are identified as English learners, the district survey data submitted to us measuring student engagement found that only 30% of New Haven students were fully participating during the spring class cancellation. This compares to 74% of the students that were engaged across the state. Survey data provided by the district also indicated that approximately 60% or 12,600 students had some form of barrier, such as health or other trauma, that prevented full participation in remote learning, compared to 17% statewide. With that, we recognize the importance to provide quality programming for the students in New Haven. New Haven is an opportunity district and receives received an additional $18 million between Alliance and adjusted ECS funds, and an additional $13 million from CARES and the Priority School District Grant. All total, New Haven receives $170 million from the state of Connecticut and $18 million from federal grants to educate its students. The metrics that were developed in close partnerships with our Department of Public Health suggest that in-school options for learning should happen when new COVID cases per 100,000 are under 10. Fully remote should be favored when there are more than 25 new cases. New Haven County is currently at 2 cases per 100,000 people per day, and the percentage positivity rate in this county is under 1%. Each support providing students the opportunity to learn in school at some point. At this point, I want to turn it over to you to hear the rationale for all remote learning. Again, it's going to be approximately 20 minutes, and then I'll turn it over to the panel to ask questions for about 25 minutes. So with that, I'll turn it over to Dr. Tracy, who will introduce the speakers for the 20-minute presentation.
So I turn it over to Attorney Mooney, whom the board has retained to make their case. So Attorney Mooney.
Thank you.
Thank you, Dr. Tracy. Thank you, Commissioner Cardona, for your remarks and this opportunity for the New Haven Board of Education to discuss with you its decision on August 5th to reopen remotely. I wanted also to thank Dr. Tracy and her team for their comprehensive planning of 3 different approaches to open for the school year. There's been a lot of discussion nationwide and statewide about whether and how schools can reopen. And as you all know, yesterday the CEA came out with a new recommendation relative to opening schools. But we're not here to engage in the national dialogue or the state dialogue. Rather, we're here to focus on New Haven and the specific characteristics of New Haven that led to a vote on August 5th by a majority of the Board of Education to reopen in a remote manner. As I hope you've seen, yesterday we submitted a position statement, and we appreciate very much the opportunity to do so. Because you have that in writing, and that was prepared in consultation with the administration and the Board of Education, I won't go over the information there. Rather, it's the position of the New Haven Board of Education that rather than listening to some lawyer talk about these issues, that would be me, it would be better for you to hear directly from board members who voted in favor of the remote reopening. And the plan here in the time we have available, and we wish to be very respectful of this panel's time, is to call upon 3 board members each to speak for about 5 minutes as to the concerns that led them personally to make this vote. Other board members are on this call, and you may have questions of them as well. We're here to share information and to listen to your concerns, and as Commissioner Cardona said, have a good, productive conversation about this very important issue. The 3 board members are Dr. Tomiko Jackson MacArthur, who is a physician practicing medicine in New Haven. Mr. Larry Conaway is a recently retired school administrator who has now agreed to serve his community further as a member of the Board of Education. And the 3rd board member who will be addressing the panel today is Dr. Edward Joyner, an educational leader who's had many roles over the years, including the Yale Child Study Center. So each of these board members will be speaking, and after their comments are made, we look forward to your questions and a discussion. So with that, I would turn it over to Dr. Jackson MacArthur.
Good afternoon. I just want to explain why you see 2 of me on your screen. It's because my laptop was the one, I think, giving the jitters in the beginning. I was embarrassed to say I think that was me. So I turned it on mute so I could see everyone. And then I have my phone giving me the audio. So that's why there's 2 of me. So good afternoon, Commissioner Cardona, the State Board of Education, state educational department folks, to Dr. Tracy and her team, Mayor Eliker, Attorney Mooney, and my colleague board members that are here today. We're here today because we were asked to come before you to kind of explain why the majority of the New Haven Board of Education voted to open our year for the first semester as remote learning. And Commissioner Cardona, I think it kind of took a lot of my jitters off when you stated plainly that we weren't kind of like in front of like an inquisition. I was very, very nervous that you were just having us come so we could kind of talk to you and answer your questions. And that you certainly, as what my understanding was, that the decision is for the districts and not to be mandated from the state. So thank you for that that reassurance in your opening statements. One thing that was stated, that 30% of our students there were only 30% who fully participated, and 60% had some form of barrier. Thank you for that information, because I hadn't had that information until today. That is one of the reasons why I voted to open remotely, because I feel that while we have a very big plan in place, that I really was not confident in the execution of the plan. And I still am not as clear as I would like to be. I feel that our plans seem a lot more reactive than proactive. We have a lot of situations where we were asking, okay, so what is in school going to look like? I still am not clear of what an in-school classroom is going to look like. I'm not clear that the buildings are ready. I'm not clear if before COVID broke out, there were no paper towels, no soaps in the bathrooms. There were a lot of situations where parents are asking questions, and I'm not quite sure that is ready. I haven't been assured that. I would like to tour the schools at some point, as Dr. Tracy had told me she tours the schools, and I was hoping to maybe get a tour with my other colleagues before we open, to see and to answer some of the questions that parents are having around us. Recently, the state sports organization decided to delay their participation, and in seeing that, it helped me also, because I myself said, we are a magnet district. We have students that come from many, many, many different communities. And one of the things that we talk about is having like many cohorts where the kids stay together. They're locally together, they're in school together. We don't know what they're doing in other parts of Connecticut as far as how they are handling their community. We're in New Haven, so we really are bringing people from all different places of the state. And to me, that is just as concerning it is for me as it is for our sports directing body, which has also recommended to delay in person with other communities. So that also helped to validate how I felt. I'm a mother. I have 2 children in the system. I'm also a physician in New Haven, where while I don't serve as a physician on the board, many of our children, I call them in our district, are my kids too. I am located in the heart of New Haven on Whaley Avenue, and I've been here for 22 years. So I have access to many of our students. And we do have a lot of students that have certain needs. And do I think that having us go into school will be a better situation? Maybe for some, but are we ready to have them there? So my stance, Commissioner Cardona, is really one of, I did not vote that I don't want to be in the school. My vote was around readiness, and I don't feel that we're ready. I have a lot of questions that I've asked that have not been clearly answered. We have also been said that we will be that money will be kept from us. And I truly don't believe that the state would keep money from a district that already is underfunded because we chose to not open around safety measures. And I would like for you, if at all you could speak to that, I would like to hear if that's true, because those are rumors that are being spread throughout the district. I'm very nervous, so excuse me. I'm nervous right now.
Don't be nervous, Dr. McCarthy. You're doing a great job.
Okay. And because we are, have a set amount of time, I am someone, although I'm nervous, that can speak for a long time. I don't want to take up too much of your time, but those are my main points. My experience, before I go off, just my experience as a physician. A lot of my colleagues are, and I speak to my colleagues all the time, are at the viewpoint, we need to get back to school. Kids go back to school. Well, my viewpoint as a physician is, while our cases are low, we are starting to see cases pop up in different places. In our town, we've had a couple pop up. I won't mention it because this is not the place. We had another town with a couple in their camp. We know, and even our city leadership, our mayor has said, we don't know when the second phase is going to come, but it is going to come. I think that with children being mostly asymptomatic, not as sick as adults, we have to be very careful with children and them spreading at home. They have their parents, their grandparents. We have many, many multi-generational households in our community. In our community, we are, I consider us one of the, we are a true urban community. We have many generations under one roof. We have grandmothers raising their grandchildren. We have we even have families where great grandparents are in the home, and that's not uncommon. It's not uncommon to have, as I say, seasoned adults, because I'm starting to be seasoned, so I'm not going to be saying old. So seasoned adults that are in the home. I am one of them. I face certain types of risk every time I go to work, but it's different. A medical office, a primary care medical office, I take certain precautions that are not being taken in the school. We have many teachers with underlying conditions that we can't control what they're exposed to. So, I really don't think that the district that I am responsible for right now is quite ready for implementation. While we have a stellar plan, which from what I'm told is being celebrated throughout the state, I know that we have worked very, very hard. I saw the effort. My concern is that the implementation piece and the thought around exposures within the school, outside the school, I'm not very confident with that. So I did vote yes with the resolution that was put forth by my colleague, Larry Conaway, who is a retired educator for many, many years, who I trust, along with what I understand. I voted to postpone, not go to school, which is what some people are saying. We are not going to go to school. We are not going to go to school. We're going to school, but we are going to school in a remote setting. And I'm just going to end it there because I can go on. But I don't know if you want me to answer any questions now, if we're waiting to the end, Commissioner Cardona.
I think this is a 20-minute period. Thank you for your comments. These are the 20-minute where New Haven can present. I believe Attorney Mooney mentioned there were going to be 3 around 5-minute comments, and then we'll turn it over and we'll take those comments into account when we ask questions. But thank you. Attorney Mooney?
Mr. Conaway, are you prepared? I would just like to interject. I think Dr. McCarthy mentioned the first semester. It's my understanding that the vote was to postpone this until the first marking period, just to be clear. And with that clarification, Mr. Conaway, would you address the panel?
Thank you. Good afternoon. My name is Larry Conaway. and I'm a New Haven Board of Education member. I too would like to thank Dr. Tracy and her administrative staff for all the work they put in for reopening 2020 school year. I also would like to thank Governor Lamont, the State Board of Education, the Exception Review Committee, and you, Dr. Cardona. I have given this situation long thought and have had many sleepless nights since August 5th when the board made the decision to open school remotely for the first marking period. My position is and remains that this is a safety and a life and death issue. I've heard from students, families, teachers, paraprofessionals, administrators in the community, and finally my fellow board members about how much they want to get back into the classroom. And I want them to get back into the classroom. However, they are concerned about the safety of our district to return to in-person learning at this time. This morning, I found out that right here in the state of Connecticut, the Colchester Public School System, which is a much smaller district than ours, will be having a delayed open. Also in our state, a hockey tournament is investigating 19 COVID-related cases. I also know the University of Connecticut and some other state universities have brought in students, and the number of COVID cases are on the rise. It started at 2, and I understand now it may be as high as in double digits. I want everybody to keep an eye on the state universities and the other Connecticut school districts. Finally, the University of North Carolina has found over 130 cases of COVID, and they made the decision to send all students home. The story of this virus changes minute by minute, and it seems as though no one knows what the final outcome will be. In observing what is going on in our state and around the country, specifically in our neighboring states, Rhode Island, New York, Massachusetts, where my daughter attends Smith College, they will be doing remote learning for the remainder of the year. New Haven is asking for a mere 10 weeks to make sure that we are working in the best interest of students, families, and teachers. We can always make up the 10 weeks that we're asking for on the back end of school, but we cannot bring back lives. I'd like to bring to your attention to page 2, item A from Attorney Muni's position statement. While statistics in Connecticut are currently favorable, the pandemic continues. The New Haven asked for more time to take additional steps before it reopens schools so that the district will be best prepared to provide such in-person instruction and to deal with an outbreak with the return of students of school if one were to occur. Further, this is extremely challenging for Black and Brown students and families. Over 80% of our students enrolled in New Haven public schools are Black and Brown. We are further working out the specifics with transportation, community exposure, classroom space issues, personal protective equipment, and staffing concerns. Staffing concerns are mounting. I want you to take into consideration the number of COVID cases that have been reported, the lives that have been lost, and what is going around us everywhere. And again, the minute by minute changes that are occurring with this virus. The mere fact that we are having a remote meeting and not meeting in person speaks volumes. In conclusion with my remarks, I thank the State Board of Education Review Panel for the opportunity to present these concerns on behalf of the community. Again, as I stated in my opening, this is a safety and life and death situation. I ask on behalf of the New Haven community on approval of this vote to delay in-person school to the end of the first market period. I think the 10-week delay is the right call. Our country and our community is in crisis, and we need to act like it. Thank you, Larry Conway.
Thank you, Mr. Conway. I'd like to call upon Dr. Edward Joyner to speak to the panel. Dr. Joyner?
Yes, I'll try to be as brief as possible and stay within my 5 minutes. My name is Edward Joyner. I'm a retired professor, principal, athletic director, teacher, night school, day school. I worked in 29 states, several foreign countries, and commonwealths over the course of my 50-some years as an educator. I'm a pre-Brown, post-Brown product of a small Southern community. So I know poverty well, and I also know deprivation. We cannot talk about this without talking about the context that we're in. And it's very clear to me that the crisis that we experience now is a failure of multivariate analysis. I hear people talking about kids as if they're the only ones in school. And thankfully, I live in the state of Connecticut, where there's collective wisdom and a level of enlightened leadership that doesn't exist in a lot of other places. Thankfully, I have a really great superintendent, mayor, and president of the school board. And so I just want to go through some variables that I think are very important here and remind you that God is in the details. I don't use the devil, and hopefully we will be rid of the devil soon. But a big issue is the PE standards. I saw a couple that I taught years ago at Stop and Shop, and they had a mask and it had a lot of dirt on it. And I said, why are you wearing that mask? She said, well, we can keep wearing it. I said, no, you can't. And this is a poor couple without transportation. And in some instances, they don't even have masks in their homes. So the idea of standards for the equipment that we need are critically important. I'd also be interested to see what the data shows in equivalent districts that have our same demographics in terms of who had access to remote learning. But if we can't assure protective equipment standards, that's a problem. If we can't reconfigure the buildings physically so that we can obey the CDC guidelines, then that's another problem. And then to say that we have 2 cases in 100,000 without massive testing is an example of proofiness. I would invite anybody to read that book. It's called The Dark Art of Mathematical Deception. We're saying we have 2 in 100,000, but yet we don't test enough people. And in order to really know the real figure, you'd have to test everybody in that universe of 100,000 to know how many people are actually asymptomatic or how many are actually sick. We don't have the fiscal resources. We are a major problem with our budget. We've never been funded properly. And all this has done is added to our challenges and our problems. Personnel challenges. We actually have more absenteeism, probably numerically, than a lot of smaller districts, simply because of the scale of what we're trying to do and the high level of population density, the illness and the stress and so on and so forth working in an urban district. The other thing that my colleague Matt Wilcox said, and his Wilcoxian wisdom, he said, we are a comorbid city. Miguel, you worked in Meriden. Desi, you worked in Bloomfield. You have a sense of it, but it's certainly not like New Haven. So we are a comorbid city with high levels of diabetes, heart disease, high blood pressure, and all the other illnesses associated with being poor, Black and brown. And since I grew up in the South, poor white folks have the same issue. And so we also have a high immigrant and undocumented population. These people are even afraid to come forward in some instances. And thank God we are a sanctuary city. And they do know that we do care, and hopefully we can get more of them to come forward. But one of the things that I want to leave you with is that they cannot learn if they cannot live. And the devastation of even one child in a family, a 3-generational family living in a crowded situation with limited or no medical care, getting sick has profound consequences for that entire family. Getting sick and being afraid to report it because I'm undocumented. Or getting sick and being unable to articulate it because I don't speak English. I don't know where to go. And so what we found is that even though we only reached 30% of our kids in the previous remote iteration, we fed everybody because we are the largest restaurant, the largest transportation system, the largest healthcare system for a lot of people, and the largest daycare center in this city. And we can't just be judged on the basis of teaching and learning because we perform a much higher function for our citizens. The physical configuration of the buildings. Buildings were not built with this pandemic in mind. And it would be very difficult to reconfigure the physical configuration of our buildings without sometimes some thought and a high adhered to standard about how many kids can be in a physical space at any particular time. The other issue is, as I said earlier, some people are wearing masks multiple times. We found now that every mask is not created equal. And I'm sure that one of our distinguished graduates from New Haven Public School System, Maritza Bond, can say that the bandana mask create more problems than they solve. So here we're going to have 20-some thousand kids coming back to school in a densely populated environment whose buildings are not configured for the kind of physical, not social distance. The problem is in this country is that we need to be socially close and physically distant. They're coming back. We have no standard for saying you can't come in unless you have this mask. And by the way, recently, yesterday, the mayor, Carcetti in LA, I have students there. Every kid in that school district will be tested. You can find it out for yourself. And so in the absence of a rigorous testing program, we won't know who has what, when, where. And so it's almost like, as I said earlier in the board meeting, it's like a lethal game of tag, Miguel, and you don't know who's in. And you can't know that until you can test enough kids, enough families, so you know who has it. And if you can't keep them in pods in the National Baseball and in all these sports programs, if you can't control that with the best medical care, all the resources they need, how are we going to do it in a poor city where 85% of the kids are on free or reduced lunch? So we need time. We need time to look at how we space our buildings. We need time to look at how we're going to deal with personnel issues. We need time to look at how we're going to deal with compliance. Anybody who's ever taught recognizes that kids don't always do what you ask them to do. And when you have kids that have masks on all day long, and oftentimes even forget. I was in the grocery store the other day, a guy had on a mask, his nose was out. This is an adult. And when I try to wear one for more than 45 minutes, it's a challenge. If I was teaching and doing that, it would be an even greater challenge. So what I want to leave you with is this. We are a poor city that has never gotten the resources that we need in order to educate kids because schools can't do it by themselves. The miseducation of children is the product of housing, unemployment, discrimination, racism, sexism, all the kinds of issues that we've dealt with as a nation that we're not dealing with well now. And until we can converge on all of those factors and work together in the spirit of e pluribus unum, we're going to always be having a tail trying to wag the dog. Our children, I made a lot of home visits when I was a teacher. And I went into homes where kids were using hot plates to cook. And in some cases, they didn't have any way to cook. I've been in homes where 5-year-olds' names were on the utility bill because the parents couldn't pay it. And so God is indeed in the details. And what I impress upon you is that when I look at you, and I look at Greeks and Latinos and Jamaicans and Irish and all these various groups, I implore you to think collectively about how we can ensure that all of our children, when they do return to school, return under the best possible conditions. And let's try to work together to make sure that we take care of some of the unaddressed issues that we faced as a state regarding education, housing, employment, and so on and so forth. If we don't work together and converge all of this on the same problems, then we're going to look back on today as the good old days. Thank you.
Thank you, Dr. Joyner. That concludes the presentation of the New Haven Board of Education, and we understand that the panel may have questions or comments. Thank you.
Thank you, Attorney Mooney, Superintendent, and members of the board who spoke. We appreciate your passion for the volunteer work you do as board members. We know board members are volunteers, and they do so because they want to do what's right for the community. And I heard certain things. I'm just going to reiterate some of the things that I heard, and then we're going to open it up to questions from our panel to you. And in that conversation, you might hear some facts that maybe you don't have yet to address some of the questions that have come up, because we want you to be informed as well as we be informed with the responses of the questions that we have. What I heard from Dr. Joyner is that the PPE standards, and I know we have the Commissioner of Public Health here. We heard about testing, budget. I know Deputy OPM Secretary Casa Diamante will speak to funding and the question that was brought up earlier by Dr. MacArthur about withholding funding. I think I want to make sure that we're very clear about how funding is going to be handled, and that there's no withholding of funding that districts get, but allotment of funding for districts that are bringing students in. So we'll hear a little bit about that. Comorbidity, I heard that from Dr. Joyner as well. Physical configuration. These are all topics that we're prepared to speak to, but also maybe share more information to help inform the decisions that New Haven makes in general. From Mr. Conaway, I heard case increases and the concerns about other communities. When cases come up, what are you going to do? And I think Deputy Commissioner Russell Tucker can speak to the metrics that we work really hard to develop, and how those are some primary indicators, but there are secondary indicators that can be used by districts when making decisions. Ultimately, the decision to allow for flexibility is because you know your community's best. We want to support you by giving you tools to use, but we also want to be very clear that it's not an arbitrary process, and that safety needs to be the priority always. When the data is where it is in Connecticut, but also if it increases. From Dr. MacArthur, I heard implementation concerns. I heard we don't have enough information. I don't know enough. Are we ready? But I also heard from all three that they appreciate the hard work of the New Haven administration, who have worked tirelessly to develop a plan. It's our responsibility, not our goal. It's our responsibility to work in conjunction with New Haven to provide the answers to the questions and the confidence that you need to have as a board to support students in their learning, and ensure that it's not just students that we're thinking about, it's the entire New Haven community. I recognize that there are multi-generational families living in one place, and that it's critically important that we keep in our minds the staff that work in our schools too, many of whom live in the New Haven community as well. But implementation is what I heard from Dr. MacArthur, not having enough information. I want to share that we stood up a team before I turn it over, and I'm going to turn it over first to board member Aaron Benham. So please be prepared to come in with your comments and your questions. We stood up a team, the school reopening support team, led by Dr. Clouet, who was a superintendent for over 20 years in Connecticut and New York, and other folks on our senior leadership team to meet with districts. And they've met on at least one occasion on a call like this with New Haven, and several in-depth conversations to help support and know that after this call happens, we're going to continue to do that. And I would recommend, I want to get this out early, I want to recommend that the board sit with that group to ask those questions, and we can have tangible responses to make sure that whatever questions you have, we can share whatever information we can so that you feel confident with the plan moving forward. So those are the topics that I heard from the three speakers, and I want to make sure that our team has an opportunity to ask the questions to make sure that the needs of the New Haven students are being met, keeping in mind that parents always have the option to keep their children home. Throughout Connecticut, parents have the option to keep their children home and learn remotely, but there are many parents who rely very heavily on the school system to provide that learning opportunity in a in-school setting, and many have reached out saying that they want New Haven to afford them that opportunity in the first parking period as well. With that, I'll turn it over to State Board Member Erin Benham.
Thank you, Commissioner, and thank you to New Haven for sharing your reasoning behind your choice of your plan. One of the great concerns that board members always have is our special needs population. And we know, especially during this pandemic time, that they have been hurt pretty badly throughout all our districts. I'd like to know what your plans are in particular for this population that so badly needs the face-to-face learning, in particular our special ed children and even our bilingual children. If someone could answer or address those populations, I'd appreciate it.
Dr. Tracy could answer that for us.
And I have with me the Special Ed Director, Ms. Tiffany Jackson, in the room with me. But I must say that's one of the populations. I am concerned about what the needs of the special education students are and the needs of the English learners, because I think they have missed out on a lot. It's for many of them, it's impossible to teach them remotely. They were not well served in the shutdown we had in the spring. They were not well served. There were a lot of challenges with this population. And I'll have Ms. Tiffany Jackson speak around the equity issues around English learners.
Oh, so I just wanted to talk. So I just wanted to talk specifically about students with disabilities. So we know and appreciate the comments that have been provided to us from the board about safety. But one of the things that we've been hearing primarily from our parents of students with disabilities that we have.
Wait a minute, point of order. Aren't we asking for what the plan is? Not a testimony? Wasn't the question what the plan is?
Right, I'm providing the information that was asked. So I'm going to talk a little bit about it. Is that even some of what has been provided to us and even the planning and even our teachers who have been great and our principals in addressing the needs of students with disabilities, we've utilized virtual platforms. We've created individual learning packets for our students. But even with that, even with those efforts, we have many children who are nonverbal, many children with significant cognitive needs that really require robust face-to-face explicit instruction. And we know that. Anything lesser than that will be to the detriment of our students. And we appreciate, we understand, and even looking at the health and safety of our students and our teachers. We have many teachers, students with disabilities who absolutely want to be in front of their students and want to be able to teach them because they know that what we've done, even during this period of time, beginning in March, really was not the optimal experience for our students. So I say that to say, yes, we did provide virtual learning experiences for our students. Yes, we engaged in being able to provide alternative learning packets for our students where the online learning didn't work. But we know that for students with disabilities, that the notion of having robust in-person, even at the very least hybrid experience with our teachers is what's optimal for our students.
Thank you. I'm going to just take a moment to just put out some very quick ground rules. I want to make sure that we have an opportunity to hear from those who have questions and the responses. I'll ask those who are asking questions to please come out with your question quickly, and then the responses to be as direct as possible so that we can get through them all. I recognize the 1 hour time is not sufficient. I'm going to extend the meeting till 3 because I don't want to rush something as important as this. I recognize some are not able to be on that long, but I don't want to rush this part of the meeting, which to me is probably the most important, where we get to hear from you about why remote learning is the best plan. Thank you, Board Member Benham. I recognize Commissioner Gifford, you have to leave the meeting at 2:30. So I'm going to transition to you quickly and ask that you communicate any information that you need to communicate based on the comments that were made earlier, and then ask your question, please. And when you speak, just identify yourself if and in your agency you work with.
Hi, Deidre Gifford, Acting Commissioner at the Department of Public Health. My screen identifies me as Dana Jensen, so I'm not trying to be incognito. That's my assistant at DPH. Good afternoon, everyone, and thank you very much for your presentation and for the careful thought that New Haven schools have put into the fall reopening strategy. I guess I certainly appreciate, understand, and resonate with many of the concerns that have been brought up. It has been, some time since we were in school face-to-face in Connecticut. I'm wondering specifically with respect to a couple of the concerns that were raised around physical plant and personal protective equipment. If anyone could share, some of the steps either that have been taken or that you feel would need to be taken in order to make the school environment adequately safe, given the numbers that we're seeing in New Haven County right now. The governor has committed funds, for these purposes, and I'm just wondering what additional steps specifically that New Haven would consider adequate to get to a place of safety.
I see Dr. Jackson MacArthur asking to speak, and I would also want the administration to speak to that, given the planning that's going on. Dr. Jackson MacArthur.
Yes, thank you, Attorney Mooney. Our district, we were supplying face shields for the teachers, and I think now face masks, if I'm not mistaken. But we are not providing universal face masks for the students. So one of my concerns was that financially, I don't know if that was feasible. But if we have something as critical as a face mask that is required, we, with the socioeconomic status of many of our families, we should be able to provide quality face masks. We should have the money to make sure that we can provide at least a KN95 type of mask for our students and our staff and whoever else is within our buildings. And I'm not sure who Attorney Mooney is going to have speak from the administration, but from what we've been told, we were first, I think, going to just give face shields, and then I believe that we were able to, as a district, provide I don't know how many masks per week, but a mask also under the face shield. But universal providing of critical masks to students was not shared with us. So I don't know if that has changed, but that's a concern. So I don't know if anyone else can speak to that.
Dr. Joyner?
You're muted, sir.
You're muted.
We're not suggesting remote remote learning as the only option. We were actually trying to buy time. Now, as far as when I made a comment about personal equipment standards, I was thinking more about on the student side. Because if you think about it, if we do everything right on the school side and the kids are wearing the same mask 5 days in a row, that's a problem. And so we have to have a standard there. We also should have what the prototype classroom should look like. You should get pictures of what our classrooms look like and what they would look like if we followed to the letter the recommendations of population distancing. And if we reduce population density in the classroom, we should also know what it looks like to change classes in high school. We probably shouldn't. We should probably send teachers to classrooms. That's what Gene Vitale suggested. Dr. Tracy, he's going to call you about that. And if you looked at that situation in Georgia, where a young lady got in trouble and then out of trouble, good trouble, for what she did, she actually did the country a service and her community a service. So if you think about a high school, I was a high school assistant principal, middle school principal. When kids are when they're changing classes, There's a whole lot of opportunities for contact, kissing and all that kind of. If you ever been a high school administrator, then you know, or a teacher, Miguel, you know what's up in high school. And so that's a compliance issue. So we ought to be able to send to the state what our elementary, middle, and high school classrooms look like physically. There should be pictures that shows you how many desks are there, where the teacher would be, how much distance is there, and is there other material that we need, like shields and what have you, to do that. And we ought to have a prototype. It almost should be like Consumer Reports. Here's what it looks like. Here's what it should look like. Here's what it shouldn't look like. And the same standard that we have for restaurants and giving them ratings based on how safe they are, we should have that standard for school. Now, I won't be around in the next probably 40 years, but it's going to change architecture because these viruses aren't going anyplace. And we're going to have to rethink the structure, the physical and the infrastructure of this country, as well as a lot of other things. But at least we have a chance now. Here's what school looks like. Here's what it has to look like in order to limit transmission of disease. Here's the equipment that everybody has to have. Parents, you talk about parental engagement. You cannot send your kid to school with the same mask every day. If you don't have a mask, we'll take care of it. We should be getting kids ready now for learning with masks on. We should be getting teachers ready for doing it, and so on and so forth. Now, one other thing, because I can be a little long-winded. I'm a college professor, coach. Here's the thing. Think about how hard it is to teach in a 90-minute block in a high school with a mask on. Think about how hard it is to manage a group of adolescents. I want to see my girlfriend. I want to see my boy. Think about all of that and recognize that we absolutely have to help these kids understand you're in a life or death situation. One mistake can set off a chain of events that could destroy your entire family.
Thank you,
There's
Mr.
such an
Leonard.
urgency that we have to also communicate. And we need it from you, the governor, and everybody else.
Thank you. I'm gonna, again, I want to make sure that we have, it's already 2:30, and I want to make sure we have the folks that have questions. I'm going to turn it over. A couple comments were made around facilities and funding. And I want to have, before we lose them on the call, Deputy Secretary of OPM respond to some of the facilities questions, the concerns, but also share information, because it seems to me that some of the board maybe don't have all the information that they need to have in order to feel more confident in the plan. I see your hand, Dr. McCarthy. We'll come to you in a second. I'm going to give the, Deputy Secretary Constantinos an opportunity to comment and then ask the questions, and then we'll come to you. Thank you.
Thank you, Commissioner, and thank you all for being here. I wear two hats, besides the one as the Deputy Secretary of OPM under Melissa McCaw, but I'm also the Director of the Office of School Construction Grants and Review. And so it is my team, Kermit Thompson and Barbara Fabiani, who came to your district and looked at 3 of the specific schools that they were asked to look at. And I noticed that they were referred to in the paper that was submitted yesterday. And I think a complete picture wasn't quite noted in the letter. And I'm sure the letter was kept short for a reason, to give those basic points. One of the things that was most interesting in that visit of the 2 of them there, because of course we do a debrief when they're back, I couldn't make that particular trip, was that the facilities director that they spoke to was indicating to them that they were working throughout the district dealing with the air handling systems in all the New Haven schools, to include ensuring all the equipment was working properly, increasing the air volume, doing a 2-hour dump on the system at the end of the day, and then converting their MERV 8 filters to 13s, which we've learned that you don't have to go all the way to a 13, but in effect doing that. And for me, it was not an unusual process. And the reason being is New Haven has been transformative when it's come to its school construction projects. I don't think there's been a single district that has accomplished close to $2 billion worth of school construction work in modern time with modern systems than the city of New Haven. So from a functionality perspective in a building, you've got some pretty good stuff down there and some pretty good systems that can, if they're working at capacity, continue to be maintained appropriately, are working efficiently as they should be. Your service providers are there, they're being utilized, they're brought in, and updating and checking and refurbishing. You should have some outstanding systems in those schools. Close to 50 projects that I've reviewed since 1994 going forward. There have been some wonderful work in New Haven, and credit to the city in pushing those projects forward. Now, that's only one piece of it, of course, is having those systems in place, working and operable. My team thought, in fact, that the three principals of the three schools that they had visited, Hill House, I believe was one, the other was Wilbur Cross, and then Fairhaven. And one of the things, even when we're building schools, we look at what's the normal absentee rate in a school? How large? What's the enrollment number? What's the normal rate that's coming into the schools? And those questions were asked of the principals of those schools. And it was indicated to us that there'll be probably, based on the amount of absenteeism and the amount and the number of students that would probably opt to be home, was to the tune of 40%, which means 60% of the students would be probably in school. Recognizing, of course, if you were to do the optimum of what CDC would say to you, everybody wearing a mask, 6 foot distancing, and arranging your seats, one would say we don't have enough classrooms, number one, and number two, you wouldn't have enough teachers. The point would be you would not use your traditional normal way of doing business right now, and that you would use, otherwise you would use spaces that you wouldn't. Auditorium space for classroom space, gym space for classroom space, cafeteria space for classroom space, because you probably wouldn't use your cafeteria in the normal sense. And more students would probably be eating in their classrooms. I'm not sure what other configurations would be, but certainly we asked districts to reach out to you. Commissioner Cardona did the same thing, to reach out to us in school construction to assist in that process. So while I recognize a full capacity classroom is 27, 26, 24, depending on the union rules in each town, whatever the capacity is, subtract the absenteeism, subtract the number of students that wouldn't be coming in because they've opted out of in-school, I would need to know what the remaining is to assume whether or not, or presume if there was enough space in the school to house the number of students there. Do schools need to change and adapt as far as structure is concerned as we move forward? Sure, in many instances, but for instance, in Missouri, they have earthquake measures within their schools. They have many different types of environments that they're dealing with that we traditionally have not dealt with in Connecticut, but we can, and we shall. And I think that's most important at this point is analyzing our systems in our schools and our spaces in our schools in conjunction with the reality that the governor has worked very hard to bring the COVID positivity rate to 0.08. We're not asking, we don't want a single child to be at risk higher than is out there at that particular point. And we're not suggesting we're Georgia, because we're not, thankfully. And we're much better off in our positivity rate than Georgia, and probably more so than 47 states. So comparing us to the other states and our school systems or our buildings probably isn't a fair analysis because our rate is so much better. From an OPM hat, as the Deputy Secretary, I know Melissa McCaw as the Secretary of OPM and the Governor was adamant, absolutely adamant, that we use part of the CARES funding, the CRF funding, to assist the school districts with PPE purchase and with cleaning materials for the schools to keep up with that and pay 100% of that cost based on what we thought it would be that was submitted by the district. Now, New Haven, assuming it was going to a hybrid type model that would suit the district well, according to the calculations, was in a neighborhood of somewhere of $4 million to assume a 100% purchase of PPE materials for cleaning the schools. There's some non-personnel transportation, some academic piece to it as well, and other professionals that may be necessary to come in to make up for some of the vulnerable staff that wouldn't be there. Those are resources that the governor insisted upon to the districts because we all know remote learning is not optimal. I, like the rest of you, am a parent. I happen to have 5 daughters, and one of them is in an 8th grade class. And last year was ridiculous for her to try to function and learn through a computer. And she's a pretty smart kid, and we don't have the problems at home that many other families may have. But she did have a situation in which she's home alone because I had to go in every day. So, and I'm sure that would happen to a lot of other students. My oldest daughter works in the Lexington School District as a child therapist and a clinical therapist. And one of the things that she brought out that is nobody wants to deal with that one child who may be sick or worse, die from corona, and nobody wants to make that decision. But she says, is it any less that if a child with anxiety dies from suicide, the mental illness that occurs to children who aren't in school that are necessary to be in school? When we talk about feeding kids, we feed them and they're in school and there's social interaction that occurs with it. Anxiety, obesity that's increased, lack of physical activity, violence that they see at home that otherwise they wouldn't have been home to see or be a part of, and the abuse that occurs when children are home and they're taken out on them. Is that a better risk than understanding that we have COVID at 0.08? Now, the funding somebody brought up that says that would be held back. The funding will be there for the academic portions and for those portions that you would utilize on the assumption based on the type of plan that you'd be utilizing. Of course, if you're all dealing remote, there will be no need for PPE, for instance, because you're all dealing remote. Or there wouldn't be need for that funding piece that would deal with transportation because you're remote, or that funding piece with cleaning of the school if you're not going to be in it. So I think it was a misinterpretation of what funding. There is that academic piece that the governor insisted on for connectivity, and of course for those families who would have opted out in any course of bringing their child to school and work with the academic piece and a device piece. So there isn't a holding back of funds. It is what are those funds that you would ordinarily need if you were in fact going hybrid versus fully remote? And what would we do to assist you?
Thank you very much. Darnell, I see you. Thank you for letting me know that you want to speak. And I know Dr. MacArthur also. What I'm going to do, just out of respect to everyone's time, is I'd like to format the next 20 minutes this way. I'm going to ask Deputy Commissioners Russell Tucker and Deputy Commissioners Naismith to get their point and their questions out. And then I'm going to turn to Darnell, who has not had a chance to speak yet, and then Dr. MacArthur to finalize the comments there. If there's more time, we'll continue, but I want to be respectful of those who came prepared with questions and wanted to speak. Okay, so with that, I'll turn it to Deputy Commissioner Russell Tucker.
Thank you, Commissioner. I'm going to start. This is Deputy Commissioner Desi Naismith. My question is for Superintendent Dr. Tracy. Dr. Tracy, you reported to us that about 14,000 students were not fully participating, an additional 2,000 students never connected. If you only offer a remote option for students, what's going to be different now than it was between March and June?
So thank you, Deputy Commissioner Naismith. The possibility still exists that is there. We have invested in trying to get one-to-one devices for all students through the grant that we were getting, the CARES Act. We have already ordered about $3-point-something million worth of devices, both iPads and Chromebooks for our students in the lower grades. We already have what we need for high school because of the generous contribution that we receive from the state through the Daugherty Foundation. But we're concerned about the lower level that do not have all that in hand at this juncture. At the same time, we're looking at, we had sent out a survey regarding the plans. We received so far from 77% of families that responded. K-8, 43% prefer hybrid, remote 57%, 9 through 12, 54% prefer hybrid, 46% would prefer complete remote learning. The plan that I presented to my board, and I'm not going to go against my board decision, that's their decision, but the plan that I presented was more of a hybrid based on preliminary information that we received in June when we sent out a survey. And the same thing is coming back, it's almost 50-50. My concern was about having parents having choices. If there's a parent who does not want to send his or her child to school, then that's their choice. If there's a parent who wants to send his or her child to school, then that's their choice. My plan was about that, or our plan from the district was about that choice. I understand and I heard the deliberations and the debates from all the different sectors. I've been inundated with parents, teachers, students about the different plans, and they're still half-half. That's coming into me. So I'm not here to actually, I would respect and adhere to and implement the board's decision and the outcome of today's deliberation, whatever that is. But I'm still going to hold my ground to say that I respect the choices, that everyone is given a choice. It's the parents' children, they're given a choice as to what they want for their children. Now, teachers, on the other hand, will also say, but Dr. Tracy, what about our choice? My answer to that was the CDC guidelines as a choice, the ADA, where they can opt out based on their pre-existing conditions. And we have received so far 90 submissions of those ADA applications. 33 of those have been verified so far as having legitimate reasons for opting out. I'm just sharing the facts as it is.
I understand. I appreciate it. I guess my question is more, what's going to be different for the 14,000 kids who weren't participating and the 2,000 kids that never connected? How will things look differently for them academically than it did between March and June?
So we are training our teachers right now to work in any of the situations. There have been trainings that have been going on for different types of how to even use Google Classroom, Google Suite to have virtual. Last time we did not have in our plan the virtual option. Okay. Now we're having that there's a virtual option, there's a full day, not just a 9 to 1 as we've had, because we were just trying to figure out what to do, being plunged into that situation. So this time it's full day for our students. We're still going to work with our youth family community engagement folks to go knock on doors as they have done in the past and find our students where they are. I don't have a full answer, Desi, as to whether or not they're going to be engaged this time or they're going to be disengaged. We just have to go into the situation and see what happens and then seek out those students that are currently disengaged.
Thank you for the response and for getting to the question specifically. I know that our members, our team have really looked through carefully the plan and have brought out specific questions. And the final question that we're going to get is from Deputy Commissioner Russell Tucker. Please ask the question and identify who you're addressing the question to. And then I did mention to Board Member Goldson and MacArthur that I'd come back to them for a comment. Deputy Commissioner Russell Tucker.
Thank you, Commissioner, and thank you all for being here and for your commitment to the students. My question is specifically on the school nutrition programs, but I want to thank Erin Bannon, board member, for the question that she asked about special education. For context, 3,267 students are students with IEPs in the district. And so from the response that I've gotten, my question was going to be, how is New England preparing to implement these IEPs remotely? for these students. And from what I hear, that's still a challenge. So I won't go back there, but my question specifically is on the school nutrition program. Somebody brought it up earlier, and I appreciated in the position statement that you mentioned the cafeteria concerns about cohorting, as well as space and that in the classroom. The district serves breakfast and lunches daily, and in some cases supper, free of charge to your 21,000 students. And you do this by virtue of the USDA community eligibility provision. So, and an additional 15,000 of your students are eligible for free meals, free and reduced price meals based on income. So please share how you will consider, Dr. Tracy, the balance that's necessary for access to this basic need for your 21,000 students in a fully remote open model. How will students have their basic nutrition needs met?
So thank you, Deputy Charlene Russell Tucker, all the names at once. It's interesting that you asked that question because during the spring, under executive order and through some federal waivers, we were able to feed everybody up to 18 years old. We did not use IDs as we normally use when regular school is in. This time around, I was informed by the director of food services that we have to implement the ID system where every student will have an ID, and they're trying to figure out how now to do that so parents can order meals ahead of time. For those who remain home, they will have where they will order the meals and have the meals ready to move, and parents will have to show IDs. So this time is going to be a little more complicated than it was in the spring.
So thank you. So to be thinking for all the students that would normally be getting their meals, breakfast, lunch, and some suppers at school, in this remote learning model, they'd have to find their way to a site in order to pick up their meals.
Yes, yes. Last time we had 38 schools that were designated sites for parents to pick up breakfast, lunch, and also sometimes supper for those who may need it. So we had all of those prepackaged. And so they were not getting like a hot meal that they would get if they were on campus. So that would be the same situation that would be followed. This time, I think the cafeteria director was contemplating trying to see how they can get some hot food in for our families.
Thank you.
Thank
So, you know, I'm being conscious of the time, and I appreciate you. We're already 21 minutes over the time I asked you to be available. We have had, I mean, we can go on for many more hours. I want to ask Darnell, who's been patiently waiting, and Dr. MacArthur to communicate what they wanted to say. I'm going to respectfully ask that you keep your comments to 3 minutes. I do want to close by 3 p.m., knowing that many people have to come off, and I do want to close with a few comments. So I'll turn it over now to Darnell.
Thank you, Commissioner Cardona. I was one of the 4 members that voted to start school remotely. We are not unreasonable we weren't unreasonable. We aren't unreasonable when we made that request. Our concern was, of course, with safety, and we did not see in the plans that we had in front of us that safety was a paramount issue. At the time, there wasn't even PPE for the teachers or the students. They had to bring their own PPE, including masks. So we're hearing that there's some movement now towards providing PPE for teachers. That's great. We want to see some of that movement also towards students, as we know through some studies that all masks are not created equal and all masks don't protect our families. Now, we have to remember that these schools are not just populated by students. They're not the only human beings in those schools. There are teachers, there are security guards, there are all kinds of other people who are in those buildings who are affected by the fact that we're going to be there. And we don't have them at the table. We don't have the teachers here at the table telling us at this meeting what their concerns are. So we have to sort of represent them. And what I'm hearing most from teachers is that they are very, very concerned about their health. They are very concerned about what's going to happen. We hear these reports about how kids don't get sick. Well, maybe that's the case. So they don't get that sick, but teachers do, adults do. and they're very concerned. So, and I'm very concerned for them. And there was a question related to disability and how that's going to be affected. We ran remote schooling for 4 months. And I'm surprised to hear that the State Department of Education doesn't know what we did around that, and that our local administration hasn't reported what we did about that. And quite frankly, our report, our plan that we submitted to the state was supposed to have plans for both remote, full class learning, and hybrid. So asking questions about remotely how folks are going to be fed and so on is a little concerning to me, because if that's not in the plan right now, then it's not that great a plan. Because we all know from the reports that we've heard from our own mayor and from other state leaders that a second wave is eventually coming. And we should already, if we don't have that plan in place on how to deal with feeding, on how to deal with difficult students that have IEPs and so on, then we got a real problem on our hands, more than we're willing to admit, because the plan is supposed to cover all that. And I think that's one of the reasons why we were concerned when we voted to start remotely, and why a lot of teachers came to us and said they were concerned. And a lot of parents, apparently 57% of the parents who were surveyed said they have concerns, and they wanted to do remote, is because people still don't understand exactly what's in the plan and how it's going to protect the safety of our families. I have a lot more to say, but I'm going to stop there. Thank you, Mr. Cardona.
I appreciate it. Thank you for your words, Mr. Goldson. A couple quick things. The governor, in his announcement, made it clear facial coverings for students and for teachers and all staff, not just teachers, will be funded. So that's one of those things. Take that off the table. And I appreciate your comment. And I think I want to take it back there to say, listen, this is conversation that has to happen. As board members, you have to feel confident in the plan. I'm not hearing that. And it's our responsibility as a state board to work with the district to help you feel that way, so that you can have the answers to the questions that you have to bring students in safely, and make sure that the adults are also being taken into consideration as they should be. Dr. MacArthur, I want to give you a couple, 2 to 3 minutes, please, to just share your thoughts. I appreciate your patience.
Thank you so much, Commissioner Cardona. And I'm going to check that off my list around the PPE. Thank you for that confirmation of universal provision of PPE for everyone in our buildings. My comment was going back to the physical plant. The woman who was under Ms. Jensen, she said it was her assistant's name. I forgot her name. But I had wanted to say around that is one of the reports that we received in the beginning, as far as what does a classroom look like. It was reported that when feasible, there would be physical distance there would be the physical distance that we're looking for with desks and with the students in the classroom. And that was very concerning to me. And I wanted to bring that to the forefront, that, we shouldn't be doing, when we say in a pandemic, we're going to do physical distancing when feasible, that's a red flag for me. So what are we going to, I don't understand that. We should be saying that we will be accomplishing that when we have students and teachers and people in our buildings, because of the pandemic that none of us ever thought we would ever witness. We must provide physical distancing for our classrooms. So that was very alarming for me to be kept hearing when feasible. That has never been cleared up either.
Okay, thank you for that. And thank you for your comments. So 6 feet when feasible. I'm looking at New Haven now, right? So 20,000 students, 50% roughly are saying they want to do remote. If a hybrid version is implemented, much like many other districts have, you would say, so there's, let's say 10,000 students that are going to participate in person. 5,000 of those would be in on one given day. A district that can accommodate 20,000 students, having 5,000 students on a given day, because you went hybrid and 50% are coming in, 50% of the 50% that signed up, you're going to get more than the 6 feet in those cases. But I recognize, again, it goes back to the point, you need to see it. You need to understand what it looks like in the classroom, and hearing about it in a very arbitrary way doesn't make you feel confident. So that's what I got from your statement, and I appreciate that. I'd like to ask Mayor Elicker also to give us an opportunity, to share your thoughts as the mayor of New Haven, and then I'm going to close the meeting with some very specific questions, but also direction. Mayor Elicker.
Thank you, Commissioner. Can you hear me? Okay. Thank you so much, and thank you to everyone for being on this call today. I just wanted to say that I think that we all have the same goal here, and there was a lot of information shared and work done by your team actually to visit our schools. And I think that you're working to help support us in many ways to address in particular the concerns that have been raised by the 4 members that voted for online learning. My hope is that we can gather again in a smaller group to continue to work towards addressing some of these issues. Obviously, we need to do this quite quickly because I know parents on all sides of this issue and teachers are anxious to make some progress and have some more certainty over the direction that we're headed. My feeling is that we can resolve many of these issues and as soon as possible get to a spot where we can bring students back in a safe and cautious way by doing this together. And so I just wanted to make sure that you all knew how much we're appreciative of the state for helping us work through and troubleshoot these issues.
Thank you, Mayor. And I want to close today's meeting with the passion that we all bring on a very emotionally charged issue. I think speaks volumes to the importance you place on these decisions and on education and on health and safety. All of you, whether you have a very strong position on one end or the other, are here because you care about the success of children in the community. And I appreciate that. And I appreciate the manner in which this meeting was held, where we listened a lot. We were able to answer questions and at times say, I don't have the answer, or I don't know, and I need to know in order to feel confident in it. It's our responsibility as a Department of Education to continue to work with your district, with your board members who make those decisions so that you feel confident. We learned the PPE information, the funding information that maybe you didn't have. I think it's critically important that members of the board who have a lot of questions see how other districts are doing it with similar concerns, how they've addressed that. You need to feel confident moving forward because you are accountable to your stakeholders there. So I'm going to direct Dr. Clouet, the advisor here at the agency, to reconvene one of those reopened committee meetings. And I would publicly ask that the 4 members who, those who spoke and those who felt uncomfortable with bringing students in hybrid, attend that and come prepared with questions. And we're going to do what we need to do to help provide some of those responses, even if that means calling through New Haven's plan or sharing ideas or getting experts from grants and construction management or the DPH experts that we rely on when we come up with our plans. We're going to do everything we can to help you feel as informed as you need to be to make the best decisions for our students. We know there are so many risks when students are not in school that we have to take into account as well, but we know you need to feel confident with the plan that your district is moving forward, and we're going to do everything in our power to help you get there as partners, as we were on this call today. So with that, I'm going to, again, thank everyone for their participation, for staying a little bit later. This is the beginning. Although there have been meetings prior to this, this is the beginning of the next chapter. Mayor Elicker, you're absolutely right. Time is of the essence, but we want to get it right. And we're going to make sure that Dr. Clouet, at some point today, just reach out to President Rivera, Board President Rivera, to set that up as soon as possible and let us know how we can help. At this point, and I guess I address Board Chair Rivera. What is the intention of the New Haven school system with regard to reopening schools?
Hi, thank you, Dr. Cardona. It was my understanding that we were going to come to this meeting and lay out the plan based on the vote that happened and sort of get direction from the state as to how we would reopen, but it seems like that's not going to be the case. So how do we move forward, I guess is my question. Would Dr. Tracy make the decision or will the board make the decision? How do you see that happening?
Well, I asked districts to make the decision, and Dr. Tracy communicated what her intention was, but that she's going to follow the board's direction, which is, I think, what brought us here. We're going to avail support, but ultimately, it's the responsibility of the board to communicate with families soon what their intention is. I understand that there was a 10-week remote period. Again, I'm going to avail our team as soon as this afternoon to set up a meeting time to help you with that. And I would encourage you to maybe have your board reconvene at whatever time you feel is appropriate once we've had opportunities to engage with your board members and be as supportive as possible to address whatever outcome might come of that. We understand that your intention is to bring students in. We see that there's a 10-week period there. What we're trying to do is give you the information that you need so that you can re-examine that and make a decision for your families and your community. Okay,
Commissioner,
so
just as
we'll follow up here.
As the Office of the Governor's Budget Division at the Office of Policy and Management, if there's questions you have with respect to funding that is being suggested to be provided to you with respect to PPE, transportation, academic support, do not hesitate to call us from now until whenever you choose to call us, and we'll make ourselves available to you at the Office of Policy and Management. On the Office of School Construction, we visited 3 of your schools. We'll be happy to visit as many as you need us to do to let you know how safe and how great of a job your Director of Facilities is doing and what we can do to assist you in organizing your classrooms, the space that can be utilized, some of the ideas other districts are using, and help you determine what that space use should be and to make it as safe as possible for you. And always remembering, we're at 0.08 at this point in time, and the governor wants to keep it that way.
Thank you, Costa. So I'm going to close the meeting by saying, a plan is only as good as the paper it's written on, unless there's confidence behind it. We're going to do whatever we can to help support New Haven and help you feel confident that the decisions you make are in the best interest of the whole community. Thank you, everyone, for being on the call. I hope you have a great afternoon.
Thank you. Thank you so much.